Ukraine in a moment. Now to events here in the UK, and dominating so much of our daily lives is, of course, the aftermath of COVID or the pandemic. How is the backlog of operations to be beaten? Well, community diagnostic centres, CDCs, apparently is the way forward. And here to tell us more is Health Secretary and Deputy Prime Minister Thérèse Coffey, joining me now. Deputy Prime Minister, good morning. How do these CDCs work? Good morning to you.
Well, we've already opened about 90 already, and that gives us the capacity to do about an extra 2 million tests, checks on people, and we're opening 10 more in the next few months. That's the plan, from the Isle of Wight to Burnley to Birmingham. And what this does, recognising that there's about 7 million backlog, and about just under 2 million of that is the getting diagnoses, and these are an important way of making sure whether people need understanding whether people need treatment at all, or what kind of treatment it is they might need. So we've opened up the capacity to tackle those backlogs, and I'm delighted to be going to Wood Green later today in order to formally open one there.
Where do you site them? Where do you find the space?
Well, they're in a mixture of different places. Sometimes they're in shopping malls, as we've got one today. Sometimes they may be attached to existing hospitals. So the point is that we try and make sure that they're in the community where it's easy to access, easy to, in effect, almost not quite drop in, but you can get referred from whether it's your doctor, pharmacists or hospitals. And the intention is that people can go and get a much more convenient way of getting that diagnosis. So opening up capacity, getting those results quicker, and allowing people to either get on with their treatment or have the relief of not needing treatment at all.
Well, that's tremendous. The best of luck to you and your colleagues trying to bring you that about. While I have the benefit of you on the line, I have to share some other, perhaps rather gloomier news. We look at the nursing profession, and they're being balloted for strike action. I've just spoken with someone involved in now balloting ambulance service workers in London and East Yorkshire and other parts of the East Midlands, Yorkshire. Is there a autumn or winter of strikes in the NHS? What are you going to do about it, Deputy Prime Minister?
Well, my predecessor accepted the independent pay review body, and that's what we are honouring. I'm conscious the unions are looking for more than that, but I think we've taken a responsible approach in honouring that independent pay review. And on about million workers on average, we'll get an extra £1,400.
Which predecessor was that? Because there have been a number of health secretaries.
Oh, sorry, I think it was Sajid Javid.
Right. I mean, I'm going to start giving you numbers because you go so quickly. It's probably best to call you number 3. What are you going to do to actually try and avert the strike action, though, Thérèse Coffey?
Well, I think we're not going to be able to change the pay settlement that we've already announced. I say it was what we accepted from the independent pay review body. But I am aware and that these situations can be challenging. That's why the government is already acting in different ways to help people with the cost of living challenge. It's why we are today repealing the health and social care levy. So instead of it being individual taxes, that this support for the health and social care gets paid from general taxation. And indeed, the amount of money we've already given, £37 billion was already set out, particularly focused on low-income families. But the extra support that we are giving to households and indeed to businesses and indeed hospitals with the cost of energy. And people are seeing that impact already in the helping to bring down inflation forecast estimates, but also the challenges that people were facing with their business budgets as well.
All right. You feature in one of the newspapers today, The Guardian. It is reported that the plan to tackle smoking, the action plan to tackle smoking, has been shelved. Is that correct, Secretary of State?
I'm not aware it's been shelved. I've been focusing on my ABCD and going into more detail on how we deliver that.
So
there's a number of prevention programmes across the Department of Health. We're looking at a number of those activities and how we keep focus on that longer term programme. But my immediate challenges are focusing on building on the NHS winter plan. That's why we've got things like the £500 million discharge fund to help people get to the right place for them to have care rather than necessarily being in hospitals. So we're working very effectively on those top priorities.
So just to clarify, the action plan will go ahead?
Well, I'm not aware of any changes to be made. I'll be looking in the next few months at all our different prevention programmes, seeing what's potentially
Right.
working, seeing how many things there. There's quite a lot of things in draft at the moment, and working that through. But my top priority is where the majority of people interact with the health and social care today.
But you're still on track to make Britain smoke-free, by which the proportion of adults who smoke needs to get down from 14.1 to 5%. You're still on track to do that by 2030.
I cannot give you a view right now because I haven't looked into this specific
general view.
prevention policies. But there's no particular reason I'm not being told that we're off track, but I'm not being told anything specifically about the programmes at all.
Dr. Coffey, you want to see Britain what's known as smoke-free, do you?
Well, I think there's an element here about prevention is better than cure. And as I say, there are existing policies out there, whether it's a combination of obesity, about recognising smoking as the source of many other diseases that people face. And understandably, we want to have a proactive, positive prevention programme as well. And that's where other ministers are focusing on that. And I will be turning my attention to that once I've got much greater detail and grip of the ABCD.
It is a yes or no, Secretary of State or Deputy Prime Minister. Do you commit to trying to make Britain smoke-free by 2030?
Well, that's the policy of the government as it stands today. That's the policy. Well, I'm a government minister, so if that's government policy today, then that's what I agree with.
You do agree.
I don't have personal views on these sorts of matters. They are government policy, and that's what we will continue to focus on.
You do think smoking is dangerous, don't you?
I think many people smoke in this country, knowing it's a potential source of all sorts of different problems that can bring health challenges immediately or indeed in later life. And that's why we have a more general prevention approach in trying to make sure that we have a healthier nation.
Why did you vote against the outlawing of smoking in cars containing children?
Oh, probably because I didn't think it was the right thing to be doing, to telling parents how to handle the situation.
So you think it's right to smoke in a car if you've got children in the car?
I think you'll find that the law. I can't recall now if the law changed or not. I think it probably did, but
I think it did.
I'm not getting into necessarily
do you think it's right?
prescriptive.
If
we want a positive prevention programme in the future.
If you're driving children in a car, you think it's okay to smoke? Just to clarify.
Well, I think I don't know what the law says today. I'm a Democrat, Nick. I think the law did get changed so that people shouldn't be smoking in cars, but that's...
and you agree with that?
You're asking me something from a decade ago. I'm
just
not quite sure why it's relevant
you don't
now.
Seem as you're so empowered with your ABCD. You have it with a passion, and you're determined to drive it through.
Absolutely,
but you seem
because that's the majority of how people
smoking,
interact with the health and social care, Nick. And I'm not quite sure where the obsession of smoking has come today.
Well, I'm just interested.
But there we go.
All right, so we talk about, and you've referenced this, the number of medically fit hospital patients who are stuck in hospital amid shortage of care workers. The one newspaper, the Daily Telegraph, has done an analysis of NHS data. 6 in 10 patients assessed as well enough to leave are not being discharged. You have referenced this earlier, so it's a problem that's in your sights. How do you hope to tackle that?
Well, one of the things we're doing, we've announced a £500 million social discharge fund, and we will be deploying that through the local NHS and working with councils for this winter. We know that there's huge variation across the country, and that's why the role of the local NHS through something called integrated care systems is so important. It's not going to be a one-size-fits-all approach right across the country. It's about taking individual things that are happening in specific hospitals with specific local authorities in order to unlock how people, or make sure that people are treated in the most appropriate place.
On the subject of hospital beds, there's some research done by the King's Trust. I'm sure you're aware of it. Do you know how many beds there are in England at this time?
There's approximately 105,000, principally 100,000 roughly in what's called acute hospitals and about 5,000 in community hospitals.
Sorry, I misspoke. It's the King's Fund. They have a total of 140,000 in total, but that's significantly down. In the late 1980s, it was 299,000. So if you allow
right.
just to finish, sorry, just to make, if I may, Deputy Brian, for my listeners, so we've gone from, it's some years ago, I accept, but all but 300,000 to just a whisker over 140, at a time when obviously the population has grown. Surely that's something that needs to be addressed. Deputy Prime Minister.
Well, the UK National Health Service is actually world leading in treating and operating on people on a day case basis, as it's called, far more than many other countries, and particularly in Europe. So it's been a change in approach that was done deliberately so that people stay in hospital for the minimum amount of time needed rather than
Deputy
extending.
Prime Minister, are they? We've just discussed how 6 in 10 patients are still there when they can go home. So this is, if I put it to you, a double whammy. We haven't got as many beds as we had before, and those we've got are being occupied by people who should be at home.
Well, I'm conscious about the capacity issues. That's why also I think we're opening up, in effect, about 7,000 beds. That's a combination of more wards being opened, but also, excuse me,
Are you all right?
also the opportunity to have remote wards as well. And what that means is that people can go home, they can be monitored from afar. We're seeing improvements in technology all the time. I think it's Watford Hospital where the average stay at home now is people returning to hospital once they've been released is under 10%, whereas on average the NHS plans that half of people may go back within a month. So it's those sorts of improvements that we continue to see. I'm conscious about the challenges on capacity of beds. That's why we've got some focus happening right now at a much more local level to try and unlock some of those problems.
But just lastly, you reference other countries. Just lastly, Deputy Prime Minister, if you allow for beds per 1,000 population, beds per 1,000, the United Kingdom stands at 2.45, Germany 7.9, Austria 7.1, France 5.9. We're less than half of France. Why are we so lamentably low in the number of beds per head?
Well, I've just pointed out that the UK is actually world leading in doing same-day treatment, and so it's a desire of the NHS, my understanding, to not keep people in overnight if they don't need to be clinically. So we've made some changes in different ways. Of course, we will continue to work on making sure that we have appropriate capacity, and that includes certainly trying our focus on trying to get people home who don't need to be in hospital, but more importantly, making sure that they get the care and treatment they need absolutely as patients.
Grateful for your time with your two briefs. Thank you. Secretary of State for Health and Deputy Prime Minister Thérèse Coffey appearing here on LBC 1 minute after 8. News is next.
On your radio, on Global Player, and
Play LBC.
leading Britain's conversation. This is LBC.
From Global's newsroom at 8 o'clock, Liz Truss will